based on up-to-date medical literature. It is meant to be comprehensive. However, your experience or the experience of your healthcare provider may be different in one or more ways. Welcome to this educational conversation module. This module should be thought of as educational tools and how they are not meant to provide this presentation advice is based on up-to-date medical literature. It is meant to be comprehensive. To view this presentation, however, as many times as you wish, or the experience of your healthcare provider on your left may be different in one or more ways, or to skip through them in any order you wish. MD-conversation modules should be thought of as educational tools. Surgery is used to repair a hydrocele. They are not meant to provide specific advice. It is a relatively minor procedure influence the choices you make and a high rate of success. Please feel free to view this presentation as many times as you wish. Most often, you may also use the player on your left. It is a congenital condition, which means that it is present in any order you wish. A hydrocele is used to repair a hydrocele. The sac is a relatively minor procedure. It is caused by a collection of fluid around the testicle. Hydroceles always only in males, on one side most often baby and the boys. Condition in newborns is congenital condition, benign, which means that cancer is not a concern. There are two types of hydrocele. A hydrocele is a swelling in the communicating hydrocele, the sac containing the testicles. The other is a non-communicating collection of fluid around the testicle. This illustration almost always shows the normal male side only, as they are seen from one side. Newborns is almost always benign. If you look at the top of the scrotum and the testicles, is not a concern. You'll see that there is a connection to the abdominal hydroceles. The testicles develop within the abdomen and remain there until the 8th month of pregnancy, when they begin to travel down into the scrotum. This illustration shows the normal male genitals. The testicles drop from one side from the abdomen. If you look at the top of the scrotum and the testicles, a fluid-filled sac that there is a connection to the abdominal cavity surrounds each testicle developed within the abdomen at birth and remain there until the 8th month flows back into the abdomen. When they begin to travel down, the opening between the abdomen and the scrotum closes. The testicles drop into the scrotum from the abdomen through a muscular ring. The purpose of this sac is to produce a small amount of vaginalis to lubricate each testicle to protect it. At birth, or soon after, it is common for some fluid to remain in the abdomen. After the opening to the abdomen between the abdomen and the scrotum research shows leaving a sac around the testicle when a baby boy is born prematurely. Most of the time, purpose of this neither pain is to produce a small amount of fluid with this to lubricate and protect the fluid is simply absorbed by the body within a year. It is common for some fluid to remain in the scrotum. In this case, the opening to the abdomen non-communicating hydrocele. Research shows that this is more common when a baby boy is born prematurely. A non-communicating hydrocele. Most of the time, there is neither pain nor between the abdomen and the scrotum is closed. The fluid is simply absorbed by the body within a year by the time the baby is 12 to 18 months old. In this case, it is called a non-communicating hydrocele. Most hydroceles that persist longer than 12 to 18 months are communicating. You can see that the opening between the abdomen and the scrotum is closed. In these cases, there is a persistent opening. The fluid will be absorbed by the time the baby is 12 to 18 months old. Processus vaginalis. No treatment will be necessary. Sometimes it has never closed. Other times, most hydroceles that persist longer than 12 to 18 months are communicating in either instance non-communicating. Fluid that flows into the scrotum from the abdomen. There is a persistent opening between the scrotum and the abdomen. These usually occur on one side only. An intervention is usually required to fix them. It has never closed, as they essentially represent a small hernia into the groin, then reopened for reasons that are not understood. This slide shows a communicating hydrocele. Fluid that flows into the scrotum from the abdomen causes the swelling opening from the scrotum into the abdomen. These usually occur on one side only. An intervention is usually required to fix them, as they essentially represent a small hernia into the groin, but it is usually not severe. This slide shows a communicating hydrocele. Note the patent hydrocele feels like a balloon that is filled with water. The scrotum into the abdomen remains open. It generally becomes smaller. Then, when the child is rarely cause pain, it increases in size. In some cases, this change is one of the things but it is usually not a non-communicating hydrocele, nor do they damage the testicles in any way. If the opening between the abdomen and the testicles is filled with water, fluid cannot get in or out. It generally becomes smaller. Then, when the child suspects that the hydrocele is communicating, there are several ways to confirm the diagnosis. Distinguishes a non-communicating hydrocele from a communicating hydrocele. If the opening between the abdomen and the testicles is closed, the fluid is clear. Fluid cannot get in or out. Transillumination. If a physician suspects that the hydrocele is rarely done as part of the workup, there are several ways to confirm the diagnosis. The first infancy, an examination is not recommended, feeling the hydrocele. Most hydroceles are non-communicating against and will go away with time as the child grows. This is called transillumination at age 1 to 2 years. Ultrasound when a hydrocele and lab testing and is felt rarely done as part of the workup for hydroceles. Surgery is the recommended
During
treatment.
infancy,
and as mentioned,
is not recommended,
it is usually performed
as most
when the child
hydrocele
is around the age of 1 or 2 years
and
will go away with time.
Surgery
as the child
may be
grows.
performed
through a small cut
Treatment
in the
is
skin
recommended
in the lower
at age
abdomen
1 to
or
2
groin
years.
area. When a hydrocele
It is
persists
important to note
and is felt
that
to
in
be
the
communicating
pediatric
age group, needle aspirations
surgery is
are
the
never
recommended
to be
treatment.
performed. And as mentioned, it is usually
Surgical
performed
repair of a
when the child
hydrocele
is around
is
the age
called
of 1 or 2 years.
hydrocelectomy.
It is not a
Surgery may be
complex
performed
procedure
through a small
and is
cut
almost
in the
always
skin
done in the
on an
lower
outpatient
abdomen or
basis.
groin area. It is important
In
to
the
note
traditional
that in
open
the
surgical
pediatric
repair,
age group, after a
needle
general anesthetic
aspirations
is administered,
are never to be
an
performed.
incision or cut is made.
Surgical
Most often
repair
into
of
the
a
groin
hydrocele
area is called hydrocelectomy. First, it is
The
not a
opening from
complex
the scrotum
procedure
to the abdomen
and is almost
the
always
processus
done
vaginalis
on an outpatient
is
basis.
identified.
The fluid is
In the
then
traditional
removed,
open
and the
surgical
opening is
repair,
closed off. After a general
Finally,
anesthetic is
the
administered,
incision
is closed,
an
with
incision or
self-dissolving
cut is
stitches, most often into the groin area. When you arrive at the hospital in the morning, first,
Blood and
the
urine
opening from the
samples
scrotum
may be
to the
taken.
abdomen,
In rare
the
cases,
processus vaginalis,
in some
is
cases,
identified. You will be able to remain
The
with
fluid
your child
is then removed,
until the anesthetic
and the opening
is
is
given and he
closed
falls
off.
asleep. Finally, the
procedure
incision
itself
is closed
generally
with
takes about
self-dissolving
30 minutes.
stitches.
When
the
the
operation
operation
is
is
completed
completed
in the morning,
your child
blood
will be
and
moved
urine
to the
samples
recovery
may
room,
be taken,
usually
in
for
rare
about
cases.
2 hours.
In some cases,
In the recovery
you will
room,
be able to
blood
remain
pressure
with
is
your
checked
child and
until
until
the
the anesthetic
anesthetic
is
is
given
given
and
and
he
he
falls
falls
There is no
asleep.
unusual bleeding. The procedure itself
Pain medication
generally
takes
takes
about
30
and your
minutes.
surgeon
will advise you about the need for medication
When the
once
operation
you're
is
back
completed,
home. Your child
it's
will be
normal for
moved
there
to
to
the
be a little
recovery
bruising
room,
and tenderness
usually
around
for
the
about 2
wound,
hours, as well as some
In the
swelling
recovery
area
room,
for
blood
about
pressure
2
is
weeks,
checked,
and the wound is inspected to make sure
Since
there is no
self-dissolving
unusual
stitches
bleeding.
are used,
Your physician will not
medication
have
is
to
given,
remove them, and your surgeon
You
will
will
advise
probably
you
be
about
advised
the
to
need
keep
for
the wound
medication
from getting
once
wet
you're back
for
home.
2 days.
It's normal
Most
for there to
normal
be a little
activities may
bruising
be
and
resumed
tenderness
within
around the
4
wound,
to 7 days.
as well as some swelling
Exceptions
in the area
are using
for about
straddle
2
toys,
weeks, such as bikes and rocking horses. Since
These should
self-dissolving
be avoided
stitches
for
are
about
used,
3 weeks.
your physician will not have to remove them.
Complications
You will probably be
after a
advised to keep the
hydrocele
wound
repair
from getting
are
wet
very
for
rare.
2 days. They may include
Most normal
bleeding
activities
or a
may be
collection of
resumed
blood in the
within
groin
4
called
to
a
7 days.
hematoma. Exceptions
Infection
are using straddle
and
toys,
damage to the blood
such as
supply of
bikes
the
and
testicle.
rocking horses. These should be avoided for
Your
about
surgeon
3
will
weeks.
explain
What signs to watch for, including
Complications
swelling that goes
after
on
a
for more than
hydrocele
3
repair
weeks, are very rare.
Fever
or
they may
redness
include
around the wound,
bleeding,
or a collection
the
of
last
blood
two
in the
could
groin
indicate
called an
an infection.
hematoma. You should
Infection
notify your physician
and damage
if any
to the
of
blood
these signs
supply
appear.
of the testicle.
The success rate
surgeon
for
will explain
hydrocele
what
repair
signs to
is
watch
extremely
for,
high, including swelling
and the chance
that
of
goes
the
on
condition
for more than 3
reappearing
weeks
is rare.
fever, or redness
In
around
summary,
the wound. A hydrocele
the last
is a collection
two
of
could
fluid
indicate
in
an
the scrotum
infection.
around a testicle. You should notify
These
your
are
physician
common in
if
newborn
any
males,
of these signs
but
appear.
most
are non-communicating hydroceles,
The
which
success
will go
rate for
away as the
hydrocele
child
repair
grows, is extremely high. Surgical
and the
correction
chance of the
is
condition
required for
reappearing
hydroceles
is rare.
usually communicating ones.
In
that
summary,
have not resolved
a
by age
hydrocele
1
is
to
a
2. collection of fluid in the
Surgical
scrotum
treatment
around
of
a testicle
hydrocele
is a simple
These are common
outpatient
in
procedure
newborn males,
with low
but
risk
most are
and a high
non-communicating
success rate.
hydroceles,
which will go away as the child grows.
These resources may help you find
Surgical
further
correction
information
is required for
support
hydroceles
about your child's
usually
condition.
communicating ones that have not resolved by age 1 to 2. Surgical treatment of
We
hydrocele
sincerely hope
is
that
a this
simple
module
outpatient
has furthered
procedure
your understanding
with low risk
of hydrocele
and a high success
and
rate.
hydrocele repair. We wish you the best for the
These
future.
resources
and thank
may
you
help
once
you
again
find further
for viewing
information
this
or
educational
support
program about your child's condition. We sincerely hope that this module has furthered your understanding of hydroceles and hydrocele repair. We wish you the best for the future, and thank you once again for viewing this educational program.